everyone. Welcome to our live stream. And here we are with Ming Vincenti. And today we're going to talk about busting the greatest myth about VA healthcare. And that is, I'm too young to get VA healthcare. Ming, can you tell us why this is a myth?
Sure, Rosalia. This is a good one to talk about because I personally have seen veterans who have this perception, and I've actually gotten calls from people who wish they had known sooner that it's always the best idea to enroll for VA healthcare as soon as you separate from your military service. You do not need to be older. You do not need to have been injured during service. You don't need to be sick. You can leave military service and be young, perfectly healthy, ready to enter the workforce, and you should still enroll for VA healthcare. The reason is because you don't want to wait until later when you do get older. You might have a stroke. You might, it's just when you get older or you lose your insurance through your employer or you have a stroke, now's not the time to start that process. So if you start it now, when you're young, you see a VA primary care provider once every 2 years. It makes you eligible for all sorts of things within VA, like the VA pharmacy. You can go to urgent care facilities that are a part of our network if you need to. And you can use emergency department on VA's dime if you are enrolled and active within the VA Maryland healthcare system. So for the veteran who says, but I'm young, I've got a job, I have insurance through my employer, I don't need that. You never know what's going to happen. So we like to say that signing up, enrolling for VA healthcare now is a safety net for the future. So like I said, I've personally gotten calls from the last one I got was from the daughter of a veteran. He was a World War II veteran. He was 93 and living in his own home and able to take care of himself up until 93. He had a fall, unfortunately, and they needed to get him into long-term care, and they needed to do it that week. And so my first question I ask when I get a call like that is he enrolled with VA healthcare? And unfortunately, in this instance, the answer was no. So I did get him over to someone on our geriatrics team who could start the process to get him in and get him the help that he needed. But I'm sure it didn't happen that week. It's a shame because I feel like, if I had said, if he had just done that 40 years ago, even 50 years ago, if he had come in, he had gotten, seen a primary care provider, just gotten familiar with what is available through the VA healthcare system, that would have just made things so much easier. And like I said, some other instances that could happen are someone is working, they've got insurance through their employer, everything's going great, and then they have a stroke. So then you have, if the veteran is not already enrolled for VA healthcare, then you have a spouse or an adult child or a caretaker who is maybe looking for the veteran's DD2 form, DD214 form that they got when they separated from the military. They're looking for the different kinds of paperwork that they'll need. And in the midst of doing everything else that you need to do when an unfortunate incident like that happens, it's just it's more of a challenge. And so you definitely can see a VA primary care provider when you're younger, when you're healthy, when you have private insurance, when you even continue to see a primary care or a doctor in the community. You can still see VA healthcare and get to know it, learn about what things you want to use within VA healthcare. Some veterans, even though they have insurance, it might be that the VA pharmacy gives them a better deal than they get through their insurance. So once you separate from the military, it's never too early to go ahead and get that process done. And what I would just like to do is share there's a few different ways that you can apply for VA healthcare. One is by telephone, 877-222-8387. And then also you can go to va.gov/health-care and click on apply online.
Can you repeat the
Sure.
hold on, we're trying to get there it is. So this is how people can apply by phone.
That's correct.
And then how do they apply online?
And it's www.va
Okay.
/health-care.
And that is online.
Yes.
And isn't there another way for people to also to apply?
Well, you can stop into a medical center. We have the Baltimore VA Medical Center on 10 North Green Street in Baltimore City near the University of Maryland. And we have the Perry Point VA Medical Center up in Cecil County. And you can stop at either of those two facilities. The enrollment center at Baltimore. Once you enter the main entrance, you turn on the left, you'll see the sign that says Enrollment Center. And at Perry Point, it is in building 361. As soon as you walk through the front door, it's right in front of you. And then you can have someone who from our enrollment and eligibility team who can help you out with that.
I think a lot of younger veterans may not know the plethora of services that VA offers. Especially, I think up at Perry Point, there's the center where people could sort of sign up for classes.
Yes.
Where they could get Tai Chi so can you talk a little bit about that?
Yes. So we definitely, we do stress to maintain, to continue being active within the VA Maryland healthcare system. You do need to see your primary care provider once every 2 years, but that's sort of your gateway to get in. But then also you can learn about a lot of different things that are available to you. And I think what you're referring to, Rosalia, is through our recreation and creative arts therapy team. They actually, we have a adaptive sports coordinator, we have a music therapist, creative arts therapist, and they work hard to not only offer different activities at Perry Point and at our Baltimore and Loch Raven facilities, but also out in the community. So they work with, I think, Baltimore Clayworks, and then they work with a couple of different recreation groups that take veterans out on kayaks. They actually go out right on off of the Perry Point campus into the water there. Equine therapy, so they take them to a nearby farm in Harford County where veterans get to work with horses. And at one point took them to an axe throwing. You know how the axe throwing became popular a couple of years ago. And they do, like I said, clay works, painting, leather works, all sorts of different activities. And because it is from our creative and recreation creative arts therapists, there is a sort of a beneficial aspect to these different activities when it comes to your mental health and your well-being. But they're definitely fun. And the veterans that I've gotten to meet that take advantage of all these different opportunities, it's really just helped them. They love it. And I love hearing about it from them. So that's something that you don't necessarily think you're going to get through VA. But it does, like I said, start with that getting into us, enrolling first, and then getting in to see your primary care provider, and then going from there.
And I also understand that women veterans are not neglected here at the VA Maryland healthcare system, that there's actually baby showers for women who are for new and expectant moms.
Yes.
So
that's another thing that you don't think of. Sure. That's another thing that you don't think of with VA is, of course, more women are serving in the military now. And with more women serving in the military, we have more veterans. More women veterans. So we do have a women's health program. We have a wonderful coordinator that oversees that. And one of the unique activities that we have is an annual baby shower for veterans who are new or expectant moms. And we hold that. We give out some wonderful gifts. The event is supported by the community and the different veteran service organizations that support us. And we've if you do a search on Google and look up news, you'll see that we've had some nice media coverage in the past on these events. And the veterans really, they love it. And again, it's not something that you would think of that you get through VA. But
okay, so I'm going to do something new. I'm going to try to present. My screen to see if it's not letting me. I could share my screen. I'm I've never done this before, but we do have I'm just going to cancel this. There is I think it's called a Q code that veterans can use to actually apply for VA healthcare. What we will do is we will drop that in the comments section when the stream ends. So if anyone has any questions about how they can apply, they can talk about you. They could get started with the QR code. Can you talk a little bit about how that QR code works for people who may not be familiar with it?
Sure. Basically, a QR code, you just take your phone and open up your camera, your smartphone, open up your camera and point it at the QR code. It will take a second and then it will bring up the website. So it's nice that you don't have to even click on anything or type in a URL. And if you bear with me a second, I'm going to see if I can actually drop just the QR code into the chat.
By the way, if anyone has any questions or comments, you could put them in the post them in the comments section. We'll see them and we'll be able to answer your questions in real time from wherever you're watching.
It's not letting me do it either, so we'll get it up there for you. And nope, it's not. It doesn't want to cooperate with me, so we'll get it up there in the chat. And definitely, you can just point your phone's camera at it and it will bring up the web page.
And one more thing we want to say, and that is, Ming, can you talk about TeleVet? Because while people who are watching this may have some great information about why they should apply for VA healthcare while they're younger, can you talk about TeleVet so that others can do the same?
Sure. TeleVet is something that we like to say for our veterans who we know are connected with us through social media or through whatever means. We know that it's likely they know another veteran who is not connected with us. And so we like to say when you learn something about VA, such as in this instance that you can enroll, and it's recommended that you enroll for healthcare early on, we say, please tell a vet. So tell a fellow veteran, mention what you've learned and how easy it is to apply. And if necessary, help them out. They may not want to talk with someone on the phone. They may not want to go online. But if you kind of help them out, it's a gift that will keep on giving. So please share what you learn and tell a vet.
Well, thank you so much, Ming, for sharing all this incredible information. We do hope that veterans actually apply for VA healthcare. Many may not know that they have to apply for VA healthcare separately from applying for their benefits. So we hope that more people who are not yet connected with VA healthcare will take advantage of the benefits that they earned through their service. So thank you all for watching, and we say bye for now.
See you next time. Bye.